Welcome to session number 2, everyone that's already joined us, and to those that are just joining. This is the Homeless and Housing Service Providers Medi-Cal Academy second session. Today we're focusing on business planning. And this session, as well as the previous session that we had on Medicaid 101 and the basics of Medi-Cal, Cal-Am community supports, these first few sessions are really targeted for agencies that are at the beginning stages of exploring housing-related community supports and just beginning to connect with managed care plans, but who may not yet be contracted. As we progress through the academy, the sessions will become more and more detailed and contain more information that will be helpful to the 38 to 40% of you that are registered that do hold contracts already with managed care plans. So I want to give that a little bit of big picture before we dig in today. This Medi-Cal Academy is funded by the California Healthcare Foundation and presented by CSH staff. And for those of you that weren't on our first session, CSH, we are a national nonprofit. We focus on housing solutions for members of our community that have been underserved. Often that looks like focusing on supportive housing or other affordable housing solutions with the intensive support services that people need to move into housing and remain successfully housed. We also are a community development financial institution, so we provide loans that are early loans for developers that are looking to develop permanent supportive housing. And then we have a training and consulting and technical assistance side of our agency, and that's where Ambrosia, Marcella, and I sit, our program side, which really focuses on getting to work with homeless and housing service providers and other systems that engage with people who are unhoused. With that, I'm going to turn it over to Ambrosia to kick us off.
Thank you so much. So we just want to make sure that everyone's on the same page with what you should take away from this experience, this training series, right? This session today. So we're going to dive deep and make sure we're defining what is a business plan overall, and then what are the essential components of a business plan specifically as it relates to opportunities to contract with managed care plans within your county as a provider of services for community support. And also we're going to be talking about what should your agency know about what's happening in the current climate, and how can you best position your organization to respond to those opportunities and capitalize on them? And then, of course, making sure that your business plan helps support that, right? So that you are walking the way you should be walking through the experience of capitalizing on opportunities and being sustainable, but also staying true and close to your mission and why you're doing the work that you're doing, and making sure that they're a good marriage, anything that we're getting involved in. So we're hoping that's what you take away from our sessions. So you may have already met me. My name is Ambrosia Crump. I use she, her pronouns. I'm a senior program manager with our national consulting team at CSH. I'm in the same time zone, but not in California, in Las Vegas, Nevada. And I'll pass it to our other team member, Cheryl, here to introduce yourself.
Thanks. For those of you that haven't yet met me, I'm Cheryl Winter. I'm also a senior program manager. I'm based in Los Angeles, California, and I also use she, her pronouns. I will pass it to Marcella McGuire.
Hey everyone, great to see everyone, and so happy to be a part of this conversation today. My name is Marcella McGuire. I lead CSH's housing work nationwide. I'm coming to you from Philadelphia, Pennsylvania, and I use she, her pronouns as well. So thank you all for being with us today, and we're so excited to be able to learn and grow and learn from you as well. I will pass it back to Ambrosia.
Thank you so much. So just to revisit the opportunities here in our Medi-Cal Academy, as Cheryl mentioned, different sessions are meant for different target audiences, right? And so this one is for those providers who are newer to the process of exploring becoming a provider through community supports, and had a business plan around that, or maybe even modify an existing business plan to make it fit best for an opportunity to secure a contract maybe with a managed care plan. There will be some sessions around some specific things around cash flow, service costs. Some folks are curious about that, so I want to make sure to highlight. We'll have a Money Matters 101 to visit those topics, and then a Money Matters 201 to explore the tools around that. You'll also see we have some sessions around evidence-based practice on how to best deliver community support services through a PSH lens, and also incorporating folks with lived experience that includes peers, community health workers into your workforce so that we're doing work that best meets the target population. We'll also have opportunities to look at managed care plan and Medi-Cal compliance requirements and claim processes, common policies and procedures as a provider, Medi-Cal documentation, and EHR elements. Whew, we have a lot to cover. As you'll see, there's some asterisks here, and I'll let Cheryl share more about why some sessions have asterisks and why some don't, and what that means for you.
Yeah, thanks, Ambrosia. So for the sessions that have the little asterisks next to it, there are multiple ways that managed care plans are contracting to deliver housing-related community supports, and it really varies by county. In some counties, there's a county entity that is already contracted with the managed care plans in your county. LA County is an example of this. Alameda and San Francisco are also examples of this. And there are a few others where a county entity like a Department of Health Services or an Office of Homeless Services Coordination may hold a contract already with a managed care plan and then may choose to subcontract to its existing provider network that it already held contracts with. So in those circumstances where another entity is holding a contract, you as a service provider may not be interested or need to then have an independent contract with a managed care provider. But some things still may change for the way that you operate your services. What might change most are your processes around referrals, screening, assessments, documentation, reauthorizations. So while you may not need to attend sessions around contracting or the compliance requirements for submitting for reimbursement and claims, you may really be interested in attending those sessions that are the final few really around policies and procedures, documentation standards, and electronic health records. For those of you that already hold contracts with managed care plans, the further we get into the series, the more applicable the topics will be to you, because we're starting out knowing that about half of our cohort do not yet have contracts, but are in those beginning planning stages of pursuing them.
Thank you so much for that. So just to clarify what we'll be covering in this agenda, we've already talked about the takeaways that you should come away with, but today we'll be specifically talking about why we're going to engage in business planning at all, why it's important. And then we're going to walk through the elements of a business plan, what should be there for our provider description, some of the financials, some of the planning we have around how we are allocating staffing and making sure that we're ready to stand up any work that comes our way for this opportunity or other opportunities, and then communicating externally and internally, maybe your business plan and your intentions, so folks are on the same page with what we're doing and where we're going. We will also be covering some business planning resources so that you have some actionable tools to put in place to help you make the changes to your existing business plan or create your business plan for the first time. And then we'll have some evaluations. They can be provider evaluations, to some self-reflection on what needs to change or happen in order for the business plan to be the best when it can. And also maybe some reflection on what needs to happen going forward if we're going to be moving forward with this particular opportunity or not. If it makes sense for us. So we'll be happy. We're so excited to share about those tools and resources beyond the lecture, the talk today. So the next slide. So I always want to start with why we're doing the work that we're doing, right? And so we're going to dive into the nuts and bolts of the business plan. We're going to talk about paperwork, and paperwork's a necessary evil for many of us, but we also want to make sure we're revisiting why we're doing this work. And I'd like to hear from some of you. You can maybe put that in the chat or talk to us now and share why you don't work at a bank, because you could. Why do you work? Why do you work where you work? Why do you do this work at all? And I saw folks in the chat also share lots of lots of feedback around why they're in the business, right? Like why we're doing this work and helping people. The really important part I want everyone to take away from this is that if you're developing a business plan or you're modifying a business plan, this needs to be at the heart of that document, of that ask and that communication that you share with your staff so that they can walk and talk out your same intentions, right? Your business plan should make that very apparent. So we want to keep that at the heart of the matter, although we're diving into the nuts and bolts of what needs to be there documentation wise. Thank you for sharing. I think you can have folks share a little more, Cheryl. So we do want to know what people have or don't have. Some folks may already have their mission and vision down pat. So we want to hear from you. Do you have a mission and vision statement? Do you have a strategic plan? Do you have a business plan and maybe these elements are captured in that? And then do you have either within your business plan or standalone a DEIB plan, a diversity, equity, inclusion, and belonging plan, which we know that equity needs to be involved in all of our decisions and all of our plans, right? Right from the bottom all the way up. So I want to hear from you guys. Maybe you can say, yes, 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 I have all those things. Or maybe we still need to work on this one.
It's also important to know, if you aren't one of the authors of these, do you know where to find them? And how often are they updated at your agency?
Listen, so they have the mission, but we're working on the other stuff. Marianne says they have all of this. We're hopefully just make it even better, maybe with some ideas or resources we share. Okay. Mission, strategic, DIB. Yes, this opportunity now we may have to. I shared with Cheryl, my colleague here, that I think business plans are kind of like resumes, right? We're telling the truth about ourselves, but maybe this is an opportunity to enhance our business plan and maybe make a version that's specific to this opportunity for contracting with a managed care plan or county. So even though it doesn't touch this yet, that's what we're working on today. So you're still in the right space.
Exactly. Many of you had indicated in your application that you do have a business plan. You do already have a diversity, equity, and inclusion plan. There are elements related to how community supports are the eligibility for community supports, the activities that will likely align with many of the existing housing services that your agency does, but you may want to dig into what would this mean in terms of financial sustainability? What will this mean if we pursue this in terms of target population served? And are we still fulfilling our mission and vision? Are we expanding to new populations, or are we continuing to serve the same people? And what does that mean in terms of equity? So this session, we're going to highlight first some of the key elements in a business plan. For those of you that already have one, it shouldn't be much new there, except that we'll talk about how you'll want to tailor it related to opportunities for contracting with managed care plans for reimbursement for these housing related community supports. Okay. So if you are not one of the primary authors of your existing business plan, one of the things that we do encourage is early on in the Medi-Cal Academy that you have a team of staff that is working on this. And that is so that as you are planning out your staffing model, understanding cash flow, understanding changes to activities and requirements for the people you serve, for the staff that are the frontline staff providing those housing related supports, for your management and supervisors, you want to be sure that you have buy-in from everyone at your agency and also from people who you are serving. So your business plan and that process of tailoring it can and should include people with lived experience, your frontline staff. You can get clarity from staff on what works currently, what processes may need tweaking. Is this an opportunity to change some workflows? Is it an opportunity if you're already changing job descriptions to update things to be more equitable or to make more sense and be more sustainable? And then also to share back with your board. And so thinking about at what point will you share different elements that you are changing in your business plan back with your board of directors as well. Additionally, in contracting with managed care plans, some will ask to see elements that you already include in your business plan. So you may already have details around your funding sources. They will want to know your mission, vision, and purpose. They'll want to know your organizational structure, your staff expertise, the evidence-based practices that you're bringing, those that are related to housing services and those that are other services like substance use disorder treatment services and mental health services. And they'll want to know and understand your capacity to take on new referrals. All right, I'm going to hand it to Marcella to give us a little bit of a 10,000 foot view of the direction of the field that we are seeing and why changes to your business plan may make sense now, even if you aren't looking to pursue a contract with managed care plans immediately.
All right, thanks, Cheryl. And thanks, everyone. As Cheryl said, this is going to be very much a what is kind of happening, what is the trends, and what do those trends mean for you in the next 2 to 3 years? You know, a business plan, a strategic plan, all of those things are about thinking through the long term. Sometimes it's really hard to sort of raise our head above the day-to-day crisis, but a lot of you, my sense is, have roles like that for your agencies. It's going to be really important for you to understand. So understand what we're talking about here. So, and make sure that these trends, et cetera, where the funding is going to be coming from, what the demographic trends are, make sure that that's integrated into your business planning process so you can address those needs as they come. So next slide, please. So in the future, we're going to be expecting a couple of things. One, structural racism, institutional racism is not going away in a short term. There is a lot of work being done. There is a lot of raising up of the questions, but making the changes we need to see in our communities in order to have equitable, thriving communities is the work of a lifetime and the work of decades. So we expect to see continuing inequities. We hope to see that they will be raised up, that people will say, what do we do about this? How do we make this change, et cetera, in our communities? We hope that we will listen more to the people who live through these challenges, et cetera, and listen to their wisdom and their knowledge about what they need in order to be thriving members of our community, but it's there and it's in place. And it'll take a long time to change. One, we expect a housing crisis that gets worse it's worse before it gets better. In California, you've got some of the most expensive housing in the country. The Biden administration has a new housing supply plan, but housing development, as you all know better than I, is slow, slow, slow. So the housing crisis is expected to get worse. The political pressure is expected to get worse before it gets better. We also see, and here's where demographics come in, the aging of people who are experiencing homelessness and housing instability. And we say that if you've lived a long time unsheltered, we like to say 50 is the new 80. What that means is what you or I may be at a certain age, someone else who's experiencing homelessness may have those challenges at a much, much earlier age. So you see the issues with mobility, you see the issues with chronic conditions that often aren't able to be managed because, like Ambrosia's slide with Maslow's hierarchy of needs, they've been worried about, that first level of food, clothing, and shelter and are not able to get to their broader and more complicated healthcare needs. So we see both the aging of who's experiencing homelessness. Homelessness is a late baby boomer demographic. That's sort of people in their late 50s, early 60s now. That's the average chronically homeless person of age, and a lot of health issues there. So we'll see the aging of people who are experiencing homelessness. We also see healthcare with a huge emphasis around social drivers or social determinants of health. All those things that we know contribute to our healthcare and yet aren't regular clinical treatment. The housing, food, transportation, safety, stress, trauma, all of those things, not general clinical services, et cetera, addressed, yet healthcare is recognizing we can't have healthy communities without addressing those needs. You're going to see the healthcare world, which means managed care plans, hospitals, clinics, do screenings, do referrals for services. They're going to come to you, say, can you get these people housing? And there's going to be a conversation. They're going to want outcomes that show that these referrals are actually leading to people receiving the services and assistance they need. And there's going to be more and more possibilities when when big money healthcare is going to be able to do some investments in the social drivers of health. How that happens, what collaborations you put together in order to be able to capture some of that to further your work is a big piece of why we're having this conversation about business planning and all these other pieces of it. States always, oh, back please. States always want to maximize use of Medicaid. It would be so much easier if many of these services came down as grants. They came down for everyone. Everybody could access them. That's not the system we live in right now. CalAIM is a Medicaid program. It is the state's effort to maximize what they call federal financial participation. That translates into if the state does a grant program and the state puts in $1, you have $1. If the state does a Medicaid program, the state puts in $1, the Fed put in $1, you have $2. You have twice as much money in order to address the work. So that's the federal financial participation that states are always trying to bring down. States are calling this work using Medicaid to pay for non-medical services. They are calling this health-related social needs. You're going to see that acronym a lot. You're going to see a lot of discussion around community-based organizations. That's what healthcare calls anybody who's nonprofit, serves people in a community, but isn't doing actual healthcare. And they're going to be trying to bring community-based organizations like yours into their provider network. Healthcare leaders, we want them to be advocate for the housing investments we know our communities need, because they know that without them, healthcare cannot meet their goals. So as healthcare broadens their focus in order to get the outcomes we're looking for, in order to address equity, we very much want to see these housing investments in the housing sector. But you've got to be positioned and have these resources that will help take you and materials for your agency to help you there. So yeah, so next slide, I believe I hand it back to Cheryl.
Okay, so now we're going to dig into the key elements of a business plan. For those of you that have the calendar invitation, or if someone in your agency does, we can either forward it to you if you didn't receive it. I'll also upload the attachments and PDFs that I put in that into the chat. The elements of a business plan, you will see these elements in one of the PDFs that is called a business planning guide, and it gives you an outline. And it essentially is your executive summary, an agency overview. So what Marcella was talking about related to social drivers of health, if your agency addresses social drivers of health like housing, or other drivers of health, that is really important to list and use that terminology if you're tailoring it to share with a managed care plan. Your staff qualifications and capacity, what evidence-based practices you are utilizing, your programs, staffing, and operations plans. This could include workflow so that managed care plans can see that you are already have existing assessments and mechanisms to document your services. And then your business plan will also include your financial plan. This will be important to share back with your board. It will be important to include staff in on decisions related to your staffing models, your caseload sizes, particularly if you're expanding to new populations. And if that new population changes the intensity of the services that you provide. If people are presenting with more acute care needs, more complex health needs, it may change your staffing caseload sizes. And then lastly, you'll want to include risk mitigating milestones. So identifying risks early on. This could be through strengths, weaknesses, opportunities, and threats, or a SWOT analysis. It will be important again to include staff at all levels in any risk mitigating planning. So your executive summary is what will be read first, but it really should be written last. As Ambrosia said at the beginning of this session, think of a business plan like you would a resume, that that top summary at the top, you may tailor slightly differently to different audiences. This executive summary, you're going to want to tailor if you're going to be sharing your business plan with a managed care plan versus what you're giving to your board. So this executive summary, you'll want to include key highlights that will speak to the managed care plan's goals. So again, you can write this section last. In the provider agency overview, you again will want to highlight and begin with your mission, your vision, and your values. This is where you can talk about how you got started and how you are continuing to meet your mission. And you can also then work in how this new funding opportunity will help you to meet that mission. You'll want to include your strengths, highlight the evidence-based practices. The Department of Healthcare Services has created a community supports policy guide. In that community supports policy guide, they explicitly outline several key evidence-based practices that homeless and housing service providers already are using and regularly practice. So the Department of Healthcare Services listed trauma-informed care, motivational interviewing, strengths-based person-centered approaches to assessments and care planning. These are things that are strengths that your agency can highlight in your business description overview. You'll then want to talk about your current funding streams, governance structure, your key staff. You'll list your boards and any affiliations and networks. The affiliations and networks are, again, going to be really important for when you are wanting to highlight how you coordinate care, who you partner with, who you currently receive referrals from. So as a member of your coordinated entry system, your continuum of care, the other housing providers you work with, the other street outreach providers you might work with and partner with, this will be really important to highlight. And then your future goals. So any new services, how they are developing, what you're adding in, other new referrals. This could be where you talk about your goals related to housing related community supports and highlighting how it fills existing gaps. Ambrosia, did you want to talk a bit more about the mission, vision, and purpose?
Thank you so much. And I heard a lot of you had a lot of this already down pat, but we're just going to revisit it again. Some of you are maybe writing your business plan for the first time, so we just want to bring everyone to the same level right now. So we can go to the next slide. So some of you may have heard of the concept of the celery test. If you're interested in business and you read maybe books around business development or business management. So Simon Sinek in his book Start With Why talks about the idea of the celery test. And the whole story behind this is about a person who wanted to start a health food store. And they got a lot of feedback from folks who are very experienced and who said, hey, there's some opportunities, or have you considered, maybe selling like M&Ms, in your store, even though you want to do a health food store because you care about helping your fellow folks access food that they normally can't access and you care about their health. M&Ms are really popular with people. I think you should still sell them. And maybe someone says, hey, Oreos, Nabisco is going to provide, a matching contract or a matching grant and fund the first few months of the cost of selling the Oreos. So you should just do it anyway because they're not going to charge you anything. In fact, you'll make more money doing it. And then maybe the celery is available to be sold at your store as a contract. And so most folks would say the obvious answer is celery. And the reason why I'm bringing this up is because sometimes opportunities are presented to us and they may or may not be a best fit as it relates to the purpose or the why behind why we're doing business to begin with, why we're engaged in the work that we do. And so we should always apply that celery test. We should always look and evaluate new opportunities and measure it against our purpose or the why around the work that we're doing. And we can go to the next slide. So really our purpose incorporates all of this, right? So we're measuring and we're applying that celery test or making sure our work has to do with what we need to do, right? Exactly, not chasing money or getting messed up and redirecting our work and not staying true to it. But this is where we can really explain to a funder why we should be the one chosen. So it's about our story, where we started, what our talents are, what our values are, and what we're passionate about doing. So we want to remember that our purpose should be part of what we document in our business plan, and that it really highlights why we're the ones being picked to do the work, why it's us. We can go to the next slide. So a vision statement, what specifically is a vision statement? So this is really a high view, big picture, big dream type of statement that you'd make. It's about, we know who we are when it comes to the why, right? The purpose is our why. The vision is what we want to see happen long term. So it may not be what we think we can do tomorrow, right? Which is end homelessness. So we want to see a world where folks do not fall through systems gaps and they're able to access the resources they need timely and efficiently, right? That's a big vision statement. And so that helps anyone who reads our business plan understand like what our ultimate dreams or goals are to see because of the work that we're doing. And a lot of you shared those visions earlier today. So thank you for that. You guys already know that. To think about what is my big vision that makes people excited to work with us. I think the next slide. So a mission statement is different. This is what is operational. A mission statement captures how we're going to make the vision statement happen. This is what we're doing day to day in order to end homelessness, in order to alleviate poverty, or to reduce hunger instances for our target population, as an example, right? So we're walking through what we're going to do is that we are going to provide evidence-based clinical care and provide housing navigation and outreach in order to connect people successfully to housing through this. And that would be what our mission statement can potentially capture for us. So this is where you maybe get more specific and drilled down. And that's the difference between maybe a mission statement versus a vision statement, right? We're operationalizing it here. So really think about, and we'll talk to this soon, maybe think about it as each piece you're going to answer in there with a purpose, mission, and vision is I came, which is my purpose. I saw, which is my vision, and I conquered, my mission statement. So I came as my purpose. I saw as my vision. I conquered is my mission. And that's what we're hoping to capture in our business plan, right? Also, we talked about some of you are at different stages with a diversity, equity, inclusion, and belonging plan. And some of you have one down. Some of you are looking at what it takes to create one. So we'll talk through maybe some things for consideration here. So first we have to look at ourselves. So this is us looking in the mirror at ourselves, internally facing. How is our staff representing best our population? Are they reflective of the folks who are receiving services? Can they relate because they're persons of lived experience? Do they meet maybe demographically the folks that we're serving? And if there's some differences, why is that? And who really has a voice at the table when it comes to decision making? Who leads the decisions at our organization, and why was that the status to begin with? And how are we changing opportunities for access if it's not matching the population we're serving or targeting, and we're not capturing the voices that we need to capture? What are we doing to change that beyond saying, oh, it's just who's available to do the work? Are we creating pathways for folks to grow in their expertise and in their skills internally so that they can be well positioned to be in those places, to be at the table, to make the decisions that are so critical to people that look like them or have experienced like them, right? And so figuring out how we're going to address inequalities, is there even stuff going on with our forms that we're using, our intake process, all of those different things that impact how people are able to successfully access our systems of care and our services. That's looking at us. And then we're going to look at externally facing. If we're in a position to be able to support change, how are we doing that effectively? So are we addressing social issues like access and disparity in access, right? What are some inequalities that we already know about, and how are we helping to advocate and help navigate our clients through those things successfully? And what do we know about the history behind maybe policies, procedures, eligibility requirements for systems and services? What harm have they created? And what can we do to modify things on our end and advocate for change externally outside of us? What can our agency do to sit at the tables to make impact and give feedback and be strategic in addressing things that we probably know really well about or have seen, but maybe we can sit at the table and be actionable in our intent to change the world around us. In particular, you want to look at where you are now, right? Not just organizationally and even the staff and how they compare to the clients you're serving, but maybe just as the state as a whole. And one example we have is just some literature that was recently released through our funder, CHCF, around capturing from Black voices their experience in navigating healthcare systems and what that felt like for them and what were some barriers for them and maybe some outcomes for treatment or lack of treatment that they received as a result of those experiences. And being able to know what's already being captured locally and statewide around service or lack thereof or access issues and how that relates to inequitable issues We want to make sure we're knowledgeable about that and can speak to that, how we can address that in our business plan to support just opening access up for folks who might be marginalized. And I see that Cheryl shared that in the chat there for folks too. Next slide.
Okay.
What do you guys think? We want to take our break now, or maybe go a little further and take a break?
You know what, I think given that we just posted the link, if we could take just a 2-minute break, I want to give you time to open that link and read just the summary of that section and thinking about the experiences that this was a study with over 3,000 Black Californians weighed in on their experiences with healthcare systems, providers, how they think about their health. As you are pursuing and thinking about pursuing contracts with managed care plans, knowing where managed care plans get their referrals from, typically from healthcare providers, knowing that they are looking for high utilizers, so people who have frequently visited emergency departments and have hospital overnight stays, that could possibly skew um, the authorized or eligible populations in a way that is not equitable. But I want you to take a look at this report and just think through what from this, in what ways do your staff represent people served? In what ways do you have diverse leadership? How does your agency help tackle some of this? Because this piece around addressing health equity is important to the Department of Healthcare Services, and they are asking managed care plans how they are going to address equity issues. So taking 2 minutes to open this up, I think would be good for us, just so that you can get your eyes on it and think about how might you then incorporate that into your program summary in a business plan. Okay, welcome back. All right, thank you for giving time for that. I appreciate it. The next sections of a business plan that we want to highlight that you may want to tweak or add, depending on where your agency is at with business planning, are around qualifications and capacity. And what I want to highlight is related to the Department of Healthcare Services guidance on qualifications for appropriate providers for these housing related community supports. So I'm going to put in the chat a link that is to the policy guide that I've mentioned a few times now. This is for all community supports. So the first few sections are for the housing related community supports. And I want to draw your attention to page 9. So allowable providers are listed as providers who have experience and expertise with providing these unique services in a culturally and linguistically appropriate manner. And then also listed is a list of evidence-based practices, as I mentioned earlier. So when you're talking about your staff qualifications, you'll want to talk about how you are uniquely positioned because of your experience providing these housing related services, using other funding, but you'll want to talk about the connections that you have and the coordination that you have with other entities. In this policy guidance, also on page 9, at the end of page 9, they talk about coordination with other entities being necessary to be successful, to help people in maintaining their tenancy. And so that could include coordination with county health, public health, substance use, mental health, and social service departments. You'll want to talk about your experiences coordinating with these agencies, with county and city housing authorities, with continuums of care, with sheriff departments and probation officers, and how you coordinate regularly with coordinated entry systems. So all of this could be under your section on qualifications and capacity. Next, you'll want to highlight your program staffing and operations plan. So who's on your staff? What are their experiences? Particularly, it will be important to highlight the lived experience and how your staff represent community members served. You'll also want to talk about any licensed staff that are on staff, how those licenses and their licensures are appropriate for the services and the target populations that you serve, or any new target populations that you'll be bringing on. So if you have staff who have a background and license in mental health services, maybe they're a licensed social worker, that will be important if you know that you'll be receiving referrals from a managed care plan for unhoused members who have serious mental illness or ongoing substance use disorders. Any licenses or certifications or credentials that you can mention that would be helpful to highlight your staff expertise is what you'll want to add here. Caseload size is also going to be important. We know that managed care plans are looking at individuals who have highly complex chronic health conditions, who are living with disabilities, who have multiple health, physical health and mental health diagnoses, and who also have engaged with healthcare services a lot and been costly to the Medi-Cal managed care plan. So caseload sizes that are what you may typically have in a outreach program or in permanent supportive housing will likely need to be reduced some. And our session on evidence-based practices on February 8th is going to look at what those evidence-based practice caseload recommendations are. And so this is one area where you may be able to say that additional funding coming from Medi-Cal managed care can help to fill the gap and adjust your caseload sizes so that you can best serve members in their unique needs and in hours that really are tailored to when they need those services. And then additionally, you'll want to highlight any supervisor experience, the trainings that you offer. So again, this is where you talk about those evidence-based practices and how you train staff and coach them and mentor them through using those evidence-based practices. And then of course, your board of directors, the history of your founders, and then any staff that you have to support data collection, outcomes tracking, data management, data entry, and analytics. That will be important as well. As I mentioned, for external partnerships, look at that policy guide. Think through who you currently have formal and informal partnerships with, who you work with the most, and highlight that if you're going to be giving this business plan or sections of it to managed care plans for contracts. All right. When thinking about your community supports team, you may have multiple other programs happening. And as you ramp up to providing and getting reimbursed for new referrals that are authorized for services, it may take time to build up full caseloads and hire new staff. But you'll want to think through not only for staff salaries, wages and benefits, you'll also want to think through what amount of staff time is being consumed with this new program, from executive director and executive leadership to your administrative staff, to your finance team, operations, any additional duties for supervisors. And you'll have to think through what needs to be changed in job descriptions, but also does that mean changing some of the titles or descriptions of staff activities in your business planning? All right, in the invitation today, we included a tool that is an Excel document. And if you are eager to test something out and try it without being given a tutorial, then feel free. For those of you that are brave, I think it's a lot of fun to dig into and just play around with. But you'll probably want to start on the tabs that are for housing navigation and transition, and also the tab that is for housing and tenancy sustaining services. I'm bringing that up because in that tool, it talks through and walks you through your staffing model. and it presents 2 evidence-based practices that are multidisciplinary teams, and then it presents 2 housing case management models that are what is traditionally talked about in the housing related community supports, where you have a housing case manager or a housing and tenancy support specialist, and they have their own caseload of people that they are working with, and there's not necessarily other team members that bring other clinical expertise. That will all be very useful to you, not only as you're talking about your workflow and operations in this piece of your business plan, but as you begin to build out your financial outlook and project costs and you're understanding your true cost of care. You'll want to think through how operations may change. And in order to do that, you'll need to read through that policy guide. That is the link that I just provided. It outlines what is expected in terms of activities. There's also on the Department of Healthcare Services website, they have a specific page that is specifically for enhanced care management and community supports. And on that page, they include sample contract language that managed care plans can use when contracting with community supports providers. This reading through that can also help give you a sense of, okay, so we're going to get a referral in, and then it's going to take some time, and then we have to then find the person. And just thinking through your workflow and your work plan and how it may be different than your current operations will be important, not only in outlining on a business plan, but also then for working with staff to communicate it back in training to supervisors and staff who have been operating in a different way. Here's an example of a workflow that was mapped out. I worked with an agency that's an enhanced care management provider, new to enhanced care management because it's a new benefit. And they are a traditional housing and homeless service provider, but they're adding in this clinical component of enhanced care management. They wanted to see and demonstrate to the health plan how information is received from the plan, how it is then passed down from a director who receives referrals down to a team, what assessments are done, where they are stored. And so you can see on the left-hand side of this screen the entity that owns or holds a part of the process. So you can see there's the managed care line where information comes in and out from the managed care plan. Then you have the agency administrator. So they may receive certain information and then pass it on to the teams that have space to bring on new clients. Then you have the case manager that's going to be doing assessments and documenting the services that they're providing. So below that, you have documentation line. So all of the places where either an existing form may need to be tailored or a new form is going to need to be created, and thinking through which data system are we using for this? How are we storing these documents? And then which of those documents need to be sent back up to the managed care plan so that we can prove our work and they can reauthorize services to continue. So it may be helpful to, with your team, start working on a work plan like this. If you are already in contract, you may have gotten a sense of how some of this workflow has happened, but maybe you haven't actually charted it out. This is going to be a good activity for you. In thinking about the service delivery, the type of services, those are outlined in the policy guide in terms of what is allowable for housing related community supports. You're going to want to think about how does this align with your current services? Are there additional services that you typically offer that aren't listed in this reimbursable activities for community supports? And what does that mean? How often will you be visiting individuals in their homes? What is the frequency of referrals? What is the location for your services? You'll want to detail this in your business plan of how things are currently, and then also highlight how things may be different or change if you are to pursue this contract with managed care. This final bullet point at the top about can the services be certified or assessed for high quality? There are some managed care plans that really want to prioritize contracting with providers who have a national accreditation or certification or some type of recognition from a third-party entity that their services are high quality. And it makes the job for the managed care plan a little bit easier because they know that this is a trusted third-party entity that knows quality in hospital administration, let's say. And so that hospital is accredited by this national entity. It makes it easy for the managed care plan to know we trust that certification. We know it's a robust process. There aren't that many certifications that exist right now for homeless and housing providers, but there are some tools in terms of fidelity tools, assessment tools that you can use. So in this slide deck, towards the end, we highlight one self-assessment that is CSH created related to standards in supportive housing. So if you are offering or looking to offer housing and tenancy and sustaining services, that may be one tool that you can then say, we scored really high on this self-assessment. We identified these are our strengths. We identified that these are the gaps we're looking to address with this new reimbursement. In terms of who you are currently serving, this is, it's going to be important that you break down the demographics, including addressing race and ethnicity. And then also, if you do know if individuals are eligible for Medi-Cal and if they are enrolled, if their enrollment is active, this will be important to note. Level of need will also be important. So if your assessment includes any type of acuity, understanding acuity of needs or intensity of service needs that someone might require, you know, where some individuals may require daily or, you know, several times a week visits in their home, and others you may visit them once a month. And your housing sustaining services could look very different depending on someone's level of need and where they are at that month. And then articulating the gaps. So who is served by which funding source right now? And are there gaps with those current funding sources? This is going to be important. We'll talk about this more in the Money Matters session, but as you talk about how these reimbursements are supplementing your services rather than supplanting existing funding. So it's not double dipping. We're wanting to identify what gaps exist and how you are using this reimbursement to address those gaps and supplement your existing services to meet the need, meet the number of people that need this service, and to meet the quality of services that we know will achieve outcomes. All right. Your financial plan. Some of you that already hold contracts are asking about this. And so this is where I did highlight the services budget tool. I included it in the invitation for today's session. We are going to highlight and walk you through this tool during our Money Matters sessions. But I gave this snapshot because I want to show you just a little bit about how it can be helpful to articulate gaps. So if you look at the third column, housing, tenancy, and sustaining services, this is an output. This tool has multiple tabs, and you're able to put your current budget and the number of people that you serve or that you anticipate serving into this budget. You're able to articulate if they have specific diagnoses or acuity needs, where you'll be serving them. So if you'll be serving them in a single project site, like a permanent supportive housing building that is single site, or if you'll be working with people in multiple apartments scattered around the community, so you'll need to have more transportation time for your case managers. There are a lot of elements that you can tailor. And what it then does is it creates an output on this slide that is pictured here. It gives you a sense of what your cost of care is per person per month. So that row, I think it's 11, that says per tenant per month cost does not include startup. So you'll see $628.32. So for this program, they put in their staff salaries, their benefits, they calculated any training costs, any additional costs for data systems and all of this. And their total cost of care per person per month is $628.32. They may be receiving nowhere near that amount from any funder, right? They may be having to braid multiple funding sources in, and this may be the picture of if they were meeting caseload sizes at the evidence-based practice standard. They may not actually be able to do that. But what we're wanting you to be able to understand is if you are having caseloads small enough to be able to really achieve these housing and tenancy sustaining outcomes, what is that true cost of care? And what gap do you have right now that this reimbursement might help you to fill? Okay. Shifting slightly to the last few elements of the business plan. So in thinking about your risk mitigating milestones that you'll be including in the plan, you'll also want to be thinking about, one of the risks that you'll want to think about is how will this impact the people that we serve? How will this impact our staff? Will all of this change impact morale? What do we do to manage change, to be inclusive in planning? So you'll want to think through how and when you're communicating your thought process, your exploration, your planning, and any updates with key leadership, with your frontline staff, and with clients. And I would recommend to start engaging clients earlier than you might think to hear their opinions about if you're not currently associated with the healthcare system and you're not currently seen as providing healthcare services, it will be helpful to hear about people's experiences in healthcare and their experiences with your agency. You'll want to start being able to paint a picture to any managed care plan about the role that you provide and how you are viewed, how you're trusted in your community, and then to think thoughtfully through with your frontline staff about what might change and how can we prevent, that we want to maintain that trust, maintain relationships if we are going to enter into relationships with healthcare partners and receive funding from Medi-Cal managed care plans. And so just thinking through how and when you'll start getting feedback and what feedback do you need to feel comfortable to move forward. This is where a SWOT analysis to mitigate risk can be helpful. We have some questions that we can provide to your team if you're interested in what types of things should we be thinking about when you're saying opportunities and threats. Ambrosia had mentioned, and someone said in the chat, mission drift. That's one, threat to think about. Strengths and weaknesses, thinking about where your agency is at in terms of your documentation and being able to submit claims. All of this could be included in your SWOT analysis. SWOT standing for strengths, weaknesses, opportunities, and threats. And then it helps you as you put it on paper to know who you need to bring in from your agency to help you think this through. One other thing I didn't mention when talking about board members is if you are in the exploration stage and you don't yet have a board member who is from a healthcare entity, who has experience working with managed care plans, who understands Medi-Cal billing, it may be important to start looking at what are ways that you can grow your board knowledge and expertise in this area, either through formal partnerships, bringing on new board members, or informal partnerships, being connected through others that your board knows. You'll want to think through and have a plan for tracking outcomes and which data systems you'll use for collecting outcomes, tracking changes in housing and health status, and the process that you'll take. This can be included in your workflow section. As I mentioned, that that one workflow I shared had a whole line that was just around like data systems and documentation. But you'll want to think through these questions of who manages each system, which staff enter into which system for which program, what does it collect, can they talk to each other? We included in the calendar invitation a PDF that is about identifying shared outcomes. And this is going to be important as you're thinking about what data use agreements and data sharing you'll want to have in place. Are you expecting yourself to track health outcomes? And do you currently know people's level of engagement with emergency departments? Or are you tracking housing outcomes? And that's something you could share with managed care plans. You know, how long someone has maintained their tenancy. That may be the data that you'll be sharing with healthcare partners, and they may then share health data back with you. So you'll want to start thinking about what you currently track, what you can commit to tracking, what might change. And then last session during the Medicaid 101 session, we asked you to have ready a guesstimate of the percent of clients served who are Medi-Cal enrolled and a percent of clients who are Medi-Cal eligible but not yet enrolled. We also encourage you to find out which managed care plans are operating in your county if you don't already know, and to understand their eligibility statements, what is on their website around who is eligible for the housing-related community supports. In this slide deck today, I'm including a link. It's at the bottom right-hand corner. You can see Medicaid requirements in California. For Health for California, they include a summary. If you are currently not tracking Medi-Cal enrollment, but you do track enrollment in other benefits like CalFresh or SSI, and there are other ways that you may be able to get at that guesstimate. So I want to encourage you, if you're just at that beginning stage of wanting to include in your business plan what percent of people that you currently serve may be eligible and why it makes sense for you to be a provider of this service because you're already serving those folks. Check this link out. It will be helpful for you just in starting to create that guesstimate. So we are talking now about outcomes and including the outcomes that your agency measures in your business plan. For CalAIM Community Supports, the Department of Healthcare Services has highlighted that there are certain outcomes they would like managed care plans to be tracking. Some of that is related to managed care plans being able to receive incentive payments based on how many community supports providers they are contracting with that are for certain community supports like housing and homeless services. Other incentive payments and outcomes measures that the Department of Healthcare Services wants to see is how many people have been housed and have they retained that housing for 6 months? So some of this data is data that you are currently tracking that if you are contracted with a managed care plan, they are going to be interested in having that information flow up to them. And so thinking about what data use agreements you'll want to have in place, and also thinking about what does the managed care plan track that are health outcomes that your services related to housing may contribute to. Is there any data that you would be interested in receiving back? Making sure that this is a partnership that feels equitable, and that if you're sharing housing related data, is there healthcare data that you can then use to say, of the people that we have housed within 6 months of housing, we have seen these health outcomes. Within 18 months of remaining housed, people have, in general, achieved these outcomes. This will be important for you to articulate to other funders. And so thinking about, are there certain goals that the Department of Healthcare Services has outlined for managed care plans that they are requiring managed care plans to track that may be helpful for you as well? I also want to highlight, in thinking about funding sources, I know some of you have already applied for the PATH cited funding, which is very exciting. There's another round that is expected to start in March of 2023. It will be important to check out both of these links. So the links should be active in the PDF that I shared. During the break, I shared a number of PDFs with you, so go to the chat and check them out. The managed care plans also had to fill out gap filling plans. So they had to identify gaps that they saw in their network of providers or that they identified for being able to roll out these community supports, including the housing related community supports. They then had to submit those gap filling plans to the Department of Healthcare Services, and those are publicly online. So you can click on this link. You should be able to read what those gap filling plans are for the managed care plans in your counties. It will be important then for you to be able to articulate in your business plan, if you don't yet have a contract, articulate how your agency is helping them to meet those gaps. Okay. It's also going to be important that you are clued into the planning collaboratives that are happening. I'm going to put a link in the chat here. This is the Department of Healthcare Services is coordinating collaboratives for planning and investment and coordination. You'll want to click on that link and find out which collaboratives are happening in your county and enroll to be a part of any future collaborative meetings. There have been past collaboratives and planning sessions that have happened, but just now in January, the Department of Healthcare Services is rolling out these official collaboratives. So you may have, I know I was in LA joining some collaborative meetings that were already happening, and then we had to re-register to be a part of those moving forward that are coordinated by the Department of Healthcare Services. So this will be important. Thanks, Ambrosia, for making sure it's a clickable link. Go ahead, check that out, and include that then in your business plan of one of the external coordination bodies that you are a part of. Okay. The managed care plans in that, I spoke about the gap filling plan, so I'm not going to belabor this, but I do want to encourage you to click on that and let's see if we can get that to the link here too, so that you can identify the gap filling plan that's relevant for you. All right. Thank you so much, Ambrosia. Appreciate it. All right, so now I just want to highlight in our last few minutes the tools that we've shared with you. So during the break, I shared a business plan guide and a sample. These are, the guide is a Word document, so you can start to fill it in or copy and paste sections from it. If you want to add certain elements to your existing business plan. The sample is one that has been shared by a provider that gave us permission to share it. We tried to remove anything identifiable so that you could use it as a sample, but just to see sort of the flow and how long it might be. This is relatively lengthy one and it's 7 pages. So I think you could get shorter than that. But for everything we covered, you know, seven may be reasonable. For those of you that are wanting to understand your return on investment and your true cost of care, I would open up that sample. It will be important to see their financial analysis section. So they project out sort of what is the ramp up time for one caseload of 10 people, the onboarding time for a case manager. So all these costs that are our startup costs that even before reimbursement, we're going to need to pay out of hand. And then how long will it take for this to be financially sustainable? And I think for their estimate, it was 3 years. I think at 18 months, they broke even, and then at 3 years. So you can see the long-term nature of this. There's a business planning documents checklist. So if you want to ensure that you have elements, all of the elements that we highlighted today, this highlights elements of, or this highlights titles of existing documents you may already have that you'll need to pull from different files and folders at your agency, but that may not all be in a business plan yet, but could be really helpful for you in creating a business plan if you don't yet have one. And I mentioned the outcomes planning assessment. So this begins with service descriptions of the housing, tenancy, and sustaining services. It then includes all the activities that are outlined by the Department of Healthcare Service for housing navigation and transition services, for housing deposits. It also lists a lot of other types of services. So the first section is 4 pages of services where you can say, yes, we provide this, we don't provide that, we're interested in providing this. I'd say the biggest piece to focus on is if any of those activities in those first 3 housing related community supports are things that you don't do right now. If you're going to contract for any one of those are activities you'll be expected to do. So you'll want to see what's different, what's new for you. The second part of that, so part 2 is looking at outcomes. So what are outcomes that managed care plans are looking for? What is typical for Medicaid programs to be interested in? Medicaid programs being the state Medicaid agency. So we talk about the Medicaid triple aim. So we've included those 3 outcomes, and then thinking about, as I mentioned, the what data sharing systems you have in place. So it gives you a worksheet to work on with your team if you're wanting something to fill out that you can then think through and start brainstorming about what outcomes you measure, what outcomes partners measure, how you can share. I also mentioned, and we've included a link here to that quality self-evaluation. So if you're wondering where your agency stacks in terms of are the services that we provide here in California in this specific county considered aligning with national best practice standards. This is a self-assessment that's free. It'll give you a report. It'll highlight the areas where you're in alignment so that you can use that in your business plan to show that you meet quality standards. It'll also help you identify areas where there are gaps. And maybe those gaps exist now because you haven't ever been able to be fully funded to meet your true cost of care. All right, and lastly, we have our next steps, so our reach. So I want to encourage you all to read that Listening to Black Californians report, explore the services budget tool. Oh, and Ambrosia, I see that I have you down for this slide, so I'm going to hand it to you because they've heard my voice for quite a long time.
Give her some breather, but
Yeah.
we're wrapping up pretty good anyway. But like she was reviewing here, some things that we could read, right? We talked about what we want to make sure we're speaking to around equity and inclusion, and making sure we're understanding what the disparities are, and reading that and letting that to help inform any modifications or creations of a plan. Definitely critical, right? What we want to explore next, that's our E here in the REACH acronym, that services budget tool that we'll be sharing out shortly, so that you can look at making some calculations on that total cost of care and what it's going to take to get started, to break even, and maybe even to generate revenue, or that good cushion to continue to be sustainable, right? And then that quality supportive housing self-assessment is available. We will be making sure you have the links around the PATH funding and the IPP as well. And then the TA vendor marketplace, I think it is live now, if I'm not mistaken, but it was supposed to drop the end of January to have access to technical assistance above and beyond even this opportunity that you have here with us, as funded through CHCF with CSH for this academy. So there may be some additional support that you're needing above and beyond the academy, and we want to make sure you're aware of any TA you can receive. So we'll make sure you have the link available to sign up for help for that. Next session is around the evidence-based practices that we mentioned at the beginning, very specifically to the housing-related community support services that you can potentially offer, and how that intersects with permanent supportive housing. And so that's coming up February 8th from 1 to 3. Hopefully we'll see some of you there if that makes sense for you to come and join us. And then if you can help us out so much, let us know how this worked for you. We will have a post-session evaluation. It's only like 3 minutes it's not a lot of syllables. Hopefully, just a lot of clicking and choosing, so that you can give us some quick and helpful feedback on how this works for you to learn, and also to help us better the experience. Um, Also, make sure to sign up for that the Path Collaborative Planning and Implementation group that Cheryl mentioned earlier. I think we dropped the link in the chat, but we want you to make sure you can complete that so you can participate and inform that process. And then have ready at the end here are some list of agency outcomes that maybe you should be tracking that help to align with managed care plan goals, like based on that ITP, the gap filling assessment, right? Or some goals that you already are aware of that they have, and maybe ways that you could start tracking some outcomes going forward, so that you know your work effects, where all of the documents will be housed that are related to all of the slide decks, the recordings, and all the tools and templates that we're sharing, so you don't have to dig through all the emails and figure out what went with what session, what am I supposed to be reading and using. We'll have it all organized and outlined on our external website. So you're going to download that for Medi-Cal Academy. And going forward, CHCF will be publicly sharing these tools and resources on their website. So save that link so that you can share that maybe with future folks who are interested in learning in the going forward. That'll be available to the community at large. And then we talked about, I don't think we talked maybe too much, the enhanced care management and community supports in lieu of services landing page. But it's important that you guys are well aware of what opportunities are presenting, and what are some of the maybe changes or the criteria and standards around community supports and the ECM services. So always making sure you're on that landing page or having that bookmark so you can see what changes or any policies requirements that might come down line for us that we need to be on top of.
That link for the DHCS, ECM, and CS landing page is where all of the guidance lives from the Department of Healthcare Services. So policy guide I mentioned today, their contract language templates for managed care plans, their billing guidance, their rate guidance, lots and lots of guidance that the Department of Healthcare Services has put together related to community supports, which includes these 3 housing related community supports. I just want to thank you all for your participation. Thanks for sticking with us. We're excited to hear how this may help you with your business planning, what elements were most useful, and if any of these tools were able to be helpful as you tailor your business plan in anticipation for these opportunities. So thank you so much. Thank you to Marcella and Ambrosia as well.
Thanks, everybody.
Thanks for joining.